plan ahead for greater outcome. Meaning, we should have a good plan, which is the key for successful outcome or the successful story of our life. Well, this is the tip for our 31st week in our journey of 40 tips to 40 weeks, where we are choosing one management principle and how to implement that trick in our journey of pregnancy and also our life. Well, welcome. I am Dr. Mukesh Gupta, Obstetrician and Gynaecologist from Lennox Malad, Mumbai. If we plan better, we are destined for a successful outcome. When we create a strategy for our childbirth and for our delivery and for our life of parenting, these are the few things that we need to really think. Now, let's first talk about a good plan. Meaning, the first thing that comes on my mind is your birth plan. What is a birth plan? Well, if you want to know the details, watch our video on the birth plan. Well, when you're talking about birth plan, these are the things that you want to look into it. What are your thoughts about normal versus C-section? What are your thoughts about the choice of the delivery services, the hospital, the team of doctors? It may be as much as the city of place where you want to deliver. Then the micromanagement part, whether you're okay with painless labor or not, whether you're okay with instrumental delivery or not, whether you would want to, what are your thoughts about feeding? Whether you would want to start the feeding immediately on bed, immediately after delivery, or you would want to buy some time. But as a doctor, we always say that it should be then and there within the first few minutes, which will help you increase the feeding. But you may have your own set of thoughts. So jot it down in a list of things, and please take it to your doctor and your team of the hospital team, which is going to support you for delivery, to remove your doubts and sort out your anxieties about these things. Who should be your companion at the time of delivery? All these things need to be planned and jotted down in your birth plan. Another important plan that you need to make is your financial planning. What do you mean by financial planning? Meaning you need to plan your finances right, so that when a situation comes in where there is an unforeseen complication, you are not caught off guard. I always love to say this, that hope for the best, but be prepared for the worst. Meaning, even if something goes southwards, not to our liking, we are still prepared, so we do not land up with a complication. So manage your finances properly. Check it out with your partner. Check it out with your insurers. Check it out with your HR. How and what are the things that can help you in case of crisis. Last but not the least is, if you do not plan for those unforeseen situations, which we call as contingency planning, then you may find yourself in an awkward position of taking substandard decisions for your and your baby's health. So, in simple words, even if there is no complication, then also there is a plethora of things that needs to be done the moment the delivery happens. Like, for example, you need to immunize yourself and your baby immediately after delivery in the first few weeks or the first few months of life. So, have you planned your finances for that as well or not? Because many times your organization, your insurers or your government may not be paying for those vaccines which are available and which are accessible today in the modern day era. Remember, the vaccines are extremely important. They are the tugboats of the power of preventive medicine. So I would always say that plan well and plan ahead for any unforeseen complication. This makes you feel peaceful and feel prepared. And if you have planned it well, and if there is a surplus amount which is still in your bank account, nobody feels bad about it, right? Thank you. Stay healthy, stay safe.